You have a mass shooting needing to have physicians that are qualified there in minutes. I do not see that being able to be accomplished by this type of model.
Tonight, the battle over PeaceHealth's emergency department goes to Salem. How lawmakers challenged the hospital's decision to cut ties with its local emergency physicians and hire an outside agency.
KVAL News at 6 starts now.
Good evening. Thanks for joining us. I'm Brandon Kammerman.
And I'm Kendall Bartley. Today, concerns over Lane County's ability to provide a rapid trauma response took the spotlight during a Senate hearing as Eugene emergency physicians presented their case to lawmakers.
And KVAL's Gold Meadows was at that hearing.
Representatives for Eugene Emergency Physicians' 41-provider team spoke before a Senate committee Thursday about PeaceHealth Oregon's decision to replace EEP employees with staff from Georgia-based ApolloMD in its emergency rooms. EEP, established in 1991 at the request of PeaceHealth, said because they've spent years creating a swift response system, they're able to quickly respond in mass emergency incidents. And it's long-standing relationships in the ER, they say, that make responding smooth.
When I call the intensivist or the doctor who staffs the ICU, I've worked with them for 10 years now, and I know them by name. I know their clinical practice patterns. They know mine.
Committee Chair State Senator James Manning said PeaceHealth's decision is important to the emergency management portion of the committee due to wanting to guarantee that quick response to mass emergencies.
In the event that we have a catastrophic event, natural disasters and stuff, we have these ER docs that are trained, experienced, and available right now.
EEP representatives warned the committee of what they called a threat to local health care posed by corporate medicine. Manning said he hopes to pause the move until the state learns if there are any legal steps that can be taken to investigate ApolloMD. Here's what Senator Manning said when we asked if he had confidence in PeaceHealth leadership.
I have no confidence in them at all. Again, we have written letters to them and they have not responded. That means that they don't care. They're going to do whatever they want to do. Well, we're going to do what we need to do.
State Senator Lisa Reynolds, who's a primary care physician in the Portland area, says knowing the doctor she's working with improves care.
When I have a child in my clinic who requires emergency care, and sometimes that's being sent by ambulance across the street to the hospital, I want to know the physician on the other side of the phone line when I'm giving a report on that child, and I want them to understand the community we live in.
On Wednesday, PeaceHealth Chief Hospital Executive Dr. Jim McGovern said the transition to ApolloMD is vital to the expansion of its emergency departments in Springfield, Cottage Grove, and Florence. McGovern said EEP did not have the ability to provide national services ApolloMD has access to, like process engineers, leadership development mentoring, and program managers for the department redesign. Still, EEP says it hopes to turn the decision around.
We want to stay and we want to take care of the community, our family members, our neighbors, and that's our ultimate goal, to continue to provide service for our families and communities.
State Senator Floyd Przansky said legislators asked the Oregon Department of Justice and Attorney General to review PeaceHealth's decision at the state level. In Salem, I'm Gold Meadows.
Now, the senator did not specify what that review would entail. EEP asked for the state to ensure full transparency regarding ApolloMD's ownership and decision-making control of the company. Now, since our earlier broadcast, we did receive a statement from PeaceHealth this evening regarding that hearing, saying, quote, all organizations participating in the RFP process confirmed to PeaceHealth before submitting proposals that they could comply with SB 951 requirements. PeaceHealth appreciates the engagement of our local and state legislators and will continue working with ApolloMD to provide thorough responses and all requested information, end quote.